So November is Lung Cancer Awareness Month. A new study from the American Lung Association shows the gap is tightening when it comes to racial disparities in lung cancer's 5-year survival rates.
But the study is also highlighting the importance of critical screenings as lung cancer remains the #1 cancer killer. So here to shed some more light on this is Dr. Anuja Sharma with Allina Health. Doctor, thank you so much for coming in this morning.
Thanks for having me this morning.
Let's dig a little deeper on some of those numbers. How prevalent is lung cancer here in the U.S.?
So we diagnose about 240,000 people every year with lung cancer in the United States. And though it is not the most common cancer, it does account for more deaths every year than the next 3 cancers put together, which is breast, colon, and prostate. So there is a heavy disease burden associated with lung cancer.
And when you take a look at these findings as it relates to racial disparities, what are the key takeaways that you see with this study?
So we all know that our ability to treat patients with a disease is dependent not only on the disease itself, but also on what we call social determinants of health, which means socioeconomic status, health literacy, the race, the ethnicity. And what the study tends to show this time is that there is a narrowing gap between the white Americans and the other races, and which is very heartening to see that gap closing significantly over the last couple of years.
And do we have any idea why? Are more people getting screened? Is this something we're focusing on more?
I think there is greater awareness about this disease, and there is decreasing stigma, though we still have a lot of things to combat to bring this forwards to people. But one of the biggest things that has happened is lung cancer screening, which went into place in 2014, even though the uptick has not been that great yet because of lack of awareness. But it does seem like moving forwards with greater education, such as programs like this, we are bringing greater attention to the need for lung cancer screening. The second thing that I would say is way better treatments that are out there, which actually target the molecular signature of individual cancers. So we're able to deliver more personalized medicine, and that is creating a great impact. And the third thing is, of course, prevention, which is decreasing your risk factors that cause lung cancer, such as smoking, environmental pollutants. Radon is a big one, especially in Minnesota.
And who should be getting screened?
So in 2014, the first recommendations came out, which got updated last year by USPSTF, which is United States Preventive Services Task Force. And what the guidelines, current guidelines are, those who are between 50 and 80 years of age, who have smoked at least 20 pack years, which means 1 pack a day for 20 years or 2 pack a days for 10 years or equivalent. And either they're still smoking or have quit within 15 years. Such individuals are deemed to be at high risk for lung cancer, and strong recommendation made that they undergo screening. And the screening utilizes a CAT scan using very low dose of radiation. So it's a little bit different than the usual CAT scans we do, and they're very safe in that context.
I'll be honest with you, doctor, I didn't even know about these lung cancer screenings. And I've lost several people close to me due to lung cancer. So you say 2014, we have a ways to go to get it out there. But with these screenings, because they are recommended, are they covered under your insurance, if you are in one of these higher risk groups?
Yes, these are considered to be preventive, and so they are covered by insurance. And Minnesota is a Medicaid federal expansion state, and these are covered for those too.
Where can we get more information if people want to find out more about lung cancer or what resources are available to them? Where should they go?
So many authoritative websites are available. Certainly I work for Allina Health, and allinahealth.org has great information. Also, I would recommend accessing National Cancer Institute, American Lung Association, American Cancer Society. They will have good information, both for individuals, and also never hesitate to talk to your primary care physicians. They have abundant knowledge on this topic and will encourage you to proceed with screening if you qualify.
All right. Well, Dr. Sharma, thank you so much for sharing this with us today. We really appreciate it.
Thank you. Thanks for your attention.